A few people joined a little bit later. So Terry, wanted to let you start by explaining a little bit what the film was about and how it came to be, and introducing your father and Ward as well. So.
Yeah, so as I'm sure you can imagine, when Greg died, our family was really shocked. Greg was a mechanical engineer. He was somebody who was super intelligent. He loved to learn. He loved a challenge. He was pretty healthy his whole life. He was still playing team sports. Had broken a couple of bones, but that was about it for his interaction with the healthcare system up until that point. And so when he died, we really wanted to understand what happened and if there was things that we could do to help to prevent it from happening again. So we started sort of asking questions, had a few different meetings with kind of stakeholders or leaders in the healthcare system. And eventually we were introduced to Ward and the team at the Health Quality Council of Alberta, who ended up doing an investigation into Greg's case. That investigation resulted in a release of a report that's called the Continuity of Patient Care Study. And for us, that whole process was incredibly important. I think we knew from day one of our interactions with Ward that we would be able to learn a lot. And we felt respected, knew that the team was going to be as transparent as they could be. They invited us into the boardroom and we learned along with them, which was really, really important for our family at that point. A couple years after the release of the report, Ward came to us with the idea, or the request, I guess, to be able to share Greg's story with the medical students when he was teaching at the medical school here in Calgary, in particular, and teaching teamwork and patient safety. And we were excited about the potential to have an impact on the next generation of doctors. We sort of came to realize that there needs to be a bit of shift in culture. And so we thought that if we could have conversations and share Greg's story with the next generation, that might be one way to have an impact. So we sort of gave the go ahead and wanted to contribute to that idea in any way that we could. Ward had reached out to his network and was introduced to Andrew Reggett and Becky Shaw, who ended up writing the script for us. And Andrew and Becky had worked a number of times with a director named Dean Bennett. He was the director of a TV show in Canada that's called Heartland. And so once we had Dean on board, we were able to recruit a professional cast and crew, which helped us pull off the quality of film that we just watched. Like I think I mentioned really quickly in the beginning, we've done more than 600 screenings. Dad and I have joined almost all of those screenings. And it's fully embedded into the medical school, a couple of different medical schools in Canada. And then it's also being used for interprofessional education and with other healthcare programs as well, which we think is important. And then there's a significant number of screenings that are either just with the public or other groups that have invited us in to share the film and have a discussion like this, which has enabled us to learn a lot. And I'm actually really excited for this conversation in particular, because I think there's probably some diverse perspectives in the room. And I think a lot of aligned purpose in why you're interested in the patient revolution, because we know that there's a lot that aligns with what we want to see for the future of healthcare as well.
Sure. Thanks, Maggie. It was a bit of a unique opportunity because at least in our healthcare system in Alberta, I don't know that we're unique though, but healthcare systems don't really like stories about Greg's, because they don't like to talk about when things go wrong. So we had a unique opportunity within a provincial health authority that and a strong CEO that decided that this was an important story. And he and I together chatted about convincing the board of directors of the HQCA, which is at arm's length from the government, but isn't completely separate from the government, to take this on and do our own report. Turned out not to be terribly popular with the government initially, but eventually everybody saw the benefit of being able to talk about a story frankly and look at ways that we could improve the system. In terms of process, we did a standard what we call a system review. So we took all of Greg's charts that Terry and Dave and the family gave us and sort of created a timeline so we understood basically what happened. And then we created a list of people to go and talk to. And then did some research and talked to sort of leading healthcare systems in the States actually about what they were doing. And so then we wrote a report about what happened to Greg, how things might have been different if the healthcare system had been put together differently, and sort of imagined a better healthcare system and wrote recommendations to try to get there. And it's one thing to do a report like that. It's another thing when you've got a family like Dave and Terry's that stand behind the report and speak to it, because it's so much more important for families to speak for change than it is for just another healthcare professional like myself.
I could start, and I'm sure the characterization isn't that much different for the people that are part of this group. I mean, when we first started, with the huge exception of Ward and his team, the reactions to our questions was defensive and to some extent condescending. And it took us a while to actually work our way through with Ward and the wonderful people that he had on his team at the HQCA to actually move through the space to be recognized as people that were actually trying to help make things better, as opposed to trying to find fault somewhere. And we've had the advantage of kind of coming from a family that is more system thinkers, so we kind of focus on that and less about individuals. And so it's been a while now. I don't think any of us would have expected to still be active 11, 12 years later, doing this work like this. But we do certainly appreciate the foundation that the HQCA and Ward's fine work created for us to work from, and also the large number of people that are really working hard inside the system to make change, swimming upstream and being frustrated themselves, in trying to make things better. So we're pretty keen to help anywhere we can with that effort. And we've learned quite a few things about the way the system functions or does not function, and some of the political character that actually holds good people back.
Yeah, the initial reaction by and large was pretty negative. People didn't really want to meet. People didn't really want to change. They were prepared to admit that the system didn't work for Greg, but the changes were slow in coming. I think we've seen that evolve. It's still not perfect. If you look at Greg's story, though, the biggest opportunities were, and why we keep coming back to it, is teamwork. And a big theme is culture as well. So if you just think about where things started to fall apart for Greg, the minute that we knew, or that it was known that he had an abdominal mass in a young man like that, the system should have gone into overdrive to move him through the system, and everybody just plodded along like it was just another case. And so it's not usual for radiologists that interpret one scan to turn around and order another scan. That's looked upon with a frown in our current healthcare system. So what happened, the radiologist did what radiologists do. They issue a report and send it back to a family doctor who can kind of push the system, but not very well. They ran into all sorts of barriers themselves. So one of our recommendations that really hasn't seen the light of day is, under certain circumstances, radiologists that see an abnormality should turn around and order the next required test and keep the family doctor on the same page and let them know what they're doing, but not push the patient back into primary care where they may struggle figuring out how to navigate the system for their patients. We talked a lot about getting into a single platform information system so that everybody had the same information. And again, if you looked at what Greg was facing, he was facing two healthcare practitioners, both of which had a really important piece of information, but they didn't know the information that each other had. And Greg wasn't a healthcare person, so understandably, he didn't know that these pieces of information were important. But if you put the two together, the lights would have gone on for everybody a lot earlier than they did about what Greg was struggling with and what he needed and how fast he needed it. So yeah, information sharing, same information platforms, people working with a different mindset and prioritizing patients like Greg more than he was at the time, we thought were really, really important.
Yeah, I think we've seen sort of an overwhelming supportive response to the film, which is a bit of different than some of the conversations about change that we were trying to have before we had the film. And it's been super interesting to share the film with diverse audiences, both in roles and different health systems, and to see how much the story resonates. And you can see that I'm half trying to read the chat, half trying to pay attention to the conversation, which I'm not necessarily always the best at, but that there's, I think the story resonates with people from lots of different roles and lots of different health systems. And that has been, has opened the door for us to learn a lot about healthcare in general, and to try and build some sort of foundational priorities that we think are critically important for the future of healthcare in general, as well as trying to focus in on how to change things for specific places as well, because we do want to see change here, but there's a lot that we can learn from other places, and both good and what not to do as well, that we wouldn't have been able to learn without the film. It would have been a lot more challenging, for sure. And it's the conversations with the next generation when we're sharing the film in the classroom, and the opportunity to meet lots of people like this group, keep us motivated and optimistic about the future of the healthcare system, because I think the next generation is starting from a different place, and there's the opportunity to sort of reinforce different culture. And I think there are a lot of people that are trying to support the right kind of change in the right future healthcare systems. And that has been really, we're really grateful for the opportunity that the film has created to connect with people. I can,
Well,
go ahead, Dad.
Go ahead.
We always do this. You think after 600 screenings, we would have some kind of system on who's going to speak first. I'll maybe start and then let Dad fill in the gaps. I think, and we've touched on this, and Ward's touched on this as well, is we really do see the need for that shift in both in mindset and in the systems and the system architecture to really enable effective teamwork in healthcare. And when we're talking about teamwork, we're including patients and families as members of their team, which should seem like a very obvious statement, but is actually in reality not really how patients get treated a lot of the time in the healthcare system. And so when we're talking about enabling the conditions for effective teamwork, we're talking about the culture where you recognize that you rely on each other to be successful in accomplishing the goals and what the patient needs, and also setting the system up. So things like being able to share information and communicate are part of the system architecture, because that is required in order to enable effective teamwork. I would imagine that there may be examples where teamwork is a little bit easier in different systems, but we really do make it hard to both culturally and systemically to work effectively as teams, especially when you're thinking of teams from the patient's perspective, because quite often when you get a significant diagnosis, patients have to navigate different organizations, different professions, different parts of the system. And doing that, quite often there was somebody in one of the screenings referred to the patient as being a hot potato. And you get tossed from one group to the next, and there's not really that feeling of teamwork or cohesion or any kind of collaboration or continuity in that experience. And so that is one of the things, both when we're talking to patients who are asking for advice, is to try and identify who that team is and recognize the role that patients and families can play as contributing members of their own team. But really trying to think of how we can enable and create the conditions for effective teamwork in healthcare.
Yeah, I would just sort of chime in on the culture piece, because that really is a dramatically different place if you actually view the patient as a partner in their care, and you ensure that the team that is working on that is focusing together as partners and moving forward in that way. And we kind of like the partnership terminology because it actually levels the playing field, and it makes it more like we're working together as opposed to patient-centered or some of the other descriptors which don't necessarily have that kind of character. And in terms of actually making progress on this, it needs to have a team that is thinking about how to work together and do that. And your organization obviously does that. The culture extends to what you've classified as industrialized medicine too. And for us, again, if you think about a partnership in care, it's not a widget processing system. It's actually having relationships that you're listening and contributing to the conversation and how you make decisions moving forward. And so if we can kind of think about doing that, not only as the patient provider relationship, but as the group that actually needs to make impact and to have that change, then we kind of need to be driven by that focus. And I think one of the things that we learned early on, and it was described some by Ward in the process of the investigation, is that, you know, the health sector, I won't call it a system because it's not a system. The health sector actually works as a bunch of individual pieces, but doesn't really learn from each other about how to work together. You don't learn how to investigate and to come up with solutions to fix that problem, because again, it's a series of individual pieces. Sort of one analogy that I used early in our discussions with, actually prior to the film, was to think about patients being in the water going down a river and needing a place to land and get care. And you have these islands that you're floating by. And in some cases, actually, people are saying, not here, not here, go someplace else. If you think about that sort of analogy, then that kind of reshapes the thought process. And it means the change in culture that needs to be there is that all those islands should have bridges and people reaching out to provide care and to partner in that process. And so that's the kind of thought process that we would like to see people understand better. And one of the things that I would say that, you know, we've learned, there are thousands of people working really hard to do that. The problem has been that, and some of the comments that have come up in the chat have been around assumptions that the public makes about the non-systems functionality and working. We're gradually getting some of those assumptions exposed through partly the pandemic and what the kind of pressure the systems are under right now. So we may have an opportunity to have better conversations, to learn, and to actually visualize going forward. Because if you think about this health non-system, it functions by reacting. It reacts to a challenge, it reacts to an illness, it reacts to something being broken, and it fixes those things. But we don't do very well at looking into the future and saying the anticipation in order to plan towards a goal, and to be able to look at the resources, the evolving technology as an example, in terms of how we can use those to reach that better place, instead of defending the processes that we have in place and sticking a Band-Aid on them to fix them. And that's a major way that we need to change the culture as well. And
Yeah,
I probably talked.
no, that all of the metaphors and descriptions were so spot on. So thank you so much, Dave.
This is advice, Meg. I think people look towards leadership, especially when things go wrong. and they sense what the culture is of a group or of an organization by what the leaders do and how they respond. If they respond openly and willingly to hearing stories, even if they're hard stories, then people are on the page of wanting to get better. I've often said, if you want to see how safe an organization is, just watch how they respond when something goes wrong. The other thing I just wanted to point out, though, is the value of when patients, families, and it's nice when patients are still alive, but in Greg's case, unfortunately, he wasn't able to be here to help push this agenda forward. So Dave and Terry are doing that, and the rest of their family. But you can tell from the way they talk, they have an axe to grind, but it's not against people. It's about changing the system. And they have an incredible ability to work with people like myself, but others in the system to make the system pay attention without putting the system on trial right there. And so I've seen them operate in lots of different forums where they're able to work with healthcare providers, and their approach is system focused as opposed to who screwed up. So that gets rid of that name, shame, and blame attitude that a lot of us have when things go wrong, whether we intend to or not. So they've got a special ability to work, and I don't think it's unique. It's just that it's very effective in my experience of working with all the way from medical students right up to, in some cases, healthcare executives, about having the discussion without making people feel super defensive. So I think this is going to be a partnership going forward. So we have to find some willing executives to work with and some willing physician leaders to work with. And then we need to have the right conversations with the patients and their families.
Good. Well, Victor and I got together about 7 or 8 years ago and put this patient revolution together into one unit. I come from a family where my father was a physician for 60 years. My mother was a nurse, and I have great feeling for the medical community. One of the things my father did was he listened to his patients. And one of the things my father did was he was an advocate for his patients. And I stress that strongly. If he didn't know the answer to something, he would call on someone that was an expert in the field and get them involved. I'm not trying to change the situation here because it can't be changed, but the situation can be improved. And I think the medical community has to look at themselves in terms of where they can be an advocate for their patients, wherever that may be. Because what I've seen in this whole picture, I've seen a lot of doctors moving the patient from one place to the other and back and forth, and nobody's really assumed to take charge. And that is something that in the future would be great if somebody did take charge. Because my father did that, and he was respected for it. And I'm not trying to change this thing, and I'm not downplaying other physicians, but I think physicians, when they see a problem, need to step up to the plate. And when they see it's not being corrected, they need to step up to the plate and do something about it. I didn't see in this picture, maybe I missed it, but I didn't see in this picture anybody from the medical side of things really moving in a direction of trying to help strongly. I saw telephone conversations being made. I saw some communication, but no evidence of really pushing forward and let's get this fellow taken care of. And he's going through it too, and that doesn't help him out at all. So that's what I wanted to say, and that's the reason we're involved with what we're doing. And you have my compassion, the family, for what you've gone through. And anything we can do, the Patient Revolution, to help in this area, we will do that.